Good day, everyone. My name is Dr. Peter Pappas, professor of medicine at the University of Alabama in Birmingham in the Division of Infectious Diseases. I'm also chair of the scientific committee of the Mycosis Study Group Educational Research Consortium, and I lead the Central Clinical Unit here at UAB. And today, we're going to do another installment of our Faces of Fungal Infection. Today, we have a quite interesting scenario, an interesting patient who we recently diagnosed with Candida auris. And so we'd like to kind of describe that story and bring the patient and his wife online and talk through this and kind of discuss what it was like and put a face to this very real clinical entity. The reason we think this is relevant, of course, we're all aware of Candida auris and the prominence that is taken in the news media recently, but even more recently, the WHO has listed it as one of their priority fungal pathogens among 18 others. But Candida auris is among the top 5. And so this is something that really we should all be aware of. It's an emerging pathogen. It's relatively late coming to the US. And what we're going to describe here is, as far as we know, the first case to have occurred in Alabama. So with that, I'm going to introduce you to our patient, Mr. Cheney. Well, good afternoon, Mr. Cheney and Ms. Cheney. Thank you guys for your willingness to share your story. And I want to thank you for being here.
Well, thank you for having us. I hope it's helpful.
Thank you for agreeing to do this. I'm going to give a little bit of a preamble to this, and then I'll ask you questions. You were transplanted earlier this year, kind of midsummer, in July of 2022. Can you kind of describe the path that led you to that, and just really briefly what led to your transplant?
Yes, sir. Well, I was a patient with pulmonary fibrosis, was diagnosed in 2019 and had been living with that. And earlier in the summer, I had some kidney stone surgery that led to a urinary tract infection that sent me to the hospital, and as best we can tell, kicked off some issues with the pulmonary fibrosis. I went to the emergency room because they could not get the urinary tract infection under control. And they put me in the hospital, and within just a few days of entering the hospital, my lungs failed completely. And I ended up on ECMO. And then we started discussing the possibility of the lung transplant at that point. They had me on ECMO for about 10 days and then got me in a position, put me on the list, and luckily got some lungs offered within just 24 hours, 28 hours, very quickly, and was on to the transplant. We had some issues with the transplant. I ended up in the hospital for 6 weeks after the transplant before I was able to come home. And I guess a week or two in is when they found the fungal problem.
That's right.
Okay, but let me fill in some history.
Yes,
so
sir.
You described that you'd been on ECMO. So you came into the hospital for other reasons. Your lungs really failed. You're getting towards end stage lung disease, but I guess this was kind of the tipping point. You developed a urinary tract infection, and it was just too much, and so you went on ECMO, and so you've defied the odds in a lot of ways. The first big hurdle is actually getting off ECMO and getting a lung transplant. That in and of itself is a minor miracle. But you did, as they were preparing to do the transplant, they did bronchoscopic studies. They did a bronchoscopy. They did a BAL, or a bronchoalveolar lavage, and they actually did recover some yeast. It was Candida albicans, which is pretty common, and we don't really make much of it. But as you indicated, you underwent a successful lung transplant, bilateral lung transplant. The donor came from Georgia. We believe it was from the Atlanta metro area. And you're doing well. But a post-op BAL, one that was performed a few days after your transplant, revealed for the first time Candida auris in the airway. That's when we started becoming familiar with this, because they called us and said, Mr. Cheney has Candida auris in his airway. He's got a little fever, but we don't think it's really causing anything. And what do we do about it? I don't expect you to remember all this, because you were in the ICU and you're just kind of struggling at that point. But I can tell you that we weren't quite sure what to do with it, because it was just sitting there, not really causing a problem. It really wasn't until about a week or so later when you developed what we call a pleural effusion, that is fluid between your lung and your chest wall, and that also grew Candida auris. That's when things got serious. They put a chest tube in, and we started to treat it, aggressively at that time. What do you recall anything from that, or Ms. Cheney? You were probably more in tune with what was going on, but what do you recall from that?
I remember just bits and pieces, but Vicki's got the better history on that.
Yeah. So from my perspective, it never really presented itself to the point that it was concerning, greatly concerning to me. There was a tiny bit of fever, but not a lot of fever. The white blood count did not ever get really elevated. So we knew it was there. We knew we were in good hands with both infectious disease and lung transplant folks. And I mean, there was some concern because everybody else was, this is being something, the first in Alabama, the first one at UAB, that was alarming, I guess. But I felt like we were in the best hands possible. And, the meds that we were, put on for, both for that and, just antibiotics in general. Even though we knew there was high risk here, that this is a resistant type of a bug. I guess there was concern, but it wasn't super scary to us. Like, okay, this is going to be a turning point, because we did feel like everything that could be done was being done for him at that time.
Yeah. Well, I agree. I think as we were seeing him, because I saw him that last 2 weeks of August, he remained stable. He was not super sick. And, the story is one that ends well, of course. He received about 4 weeks of micafungin IV. And at the time of his discharge in early September, that antifungal course was completed. The chest tube was removed. And, things have continued. We're here in, mid to late November, and things have continued to go pretty well. So, Mr. Cheney, can you confirm that, or how are things going for you right now?
Yes, things are going well. Not as good as I would like, of course. I'm fairly impatient, but I mean, all the doctors from the lung transplant team seem to be happy and say that I'm hitting goals that they want me to hit. And I continue to work at the rehab and just basically the way they say is put time behind it. And the farther I get away from it, the better things should be. As far as the cannabis, I'll say this, what parts I do remember, like Vicki said, I mean, we were concerned about it, but because other people were, and y'all were putting so much emphasis on it, but really, we never saw any symptoms out of it. And with everything else that was going on, I had to separate what might have been problems with cannabis versus the lung transplant itself. And I had been septic before the cannabis was found, and from the UTI issues, but they had me on such heavy antibiotics and treatment for that. Did that, I don't know, did that overlap and keep the cannabis problem down, or
Yeah.
It's hard for me to separate those issues.
Yeah, I think that's probably pretty typical. Let me ask you, let's go back for a little bit, because we're gonna continue to scratch our head as to where this came from.
Yeah.
Our best bet, and I think it's strongly, very, very likely that this was from the donor. The metro Atlanta area is relatively high incidence. We just couldn't confirm it, but there's pretty strong evidence that it came from the donor. But let's ask you, in the few months leading up to your transplant, had you been traveling anywhere? Had you been leaving the area? Does your job kind of take you on the road? Had you been hospitalized for any length of time? Either within or outside of Alabama, any kind of potential exposure where you might have come in contact with this organism?
No, there was really no exposure possibility there. My wife and I both had been working from home since the start of the COVID issues. So
Okay.
we had been pretty much keeping to ourselves. The only times we really got out of the house was to go to church. And because of my pulmonary fibrosis, we were being extremely careful with that, because we knew we didn't need to get COVID with me in the condition I was in. There had been no traveling. So it was a head scratcher for us that way. The one thing I'd like to say too is that, the lungs came out of the Georgia area. And that seems to be, and even the lung transplant team, was saying that's the only thing that made sense for them. It came from the donor, but I understand that they did check, and that donor, there are several other organs used in different transplants, and it didn't show up in anything else other than the lungs, which just makes it more of a mystery to us.
Yeah, I think that's accurate. Okay, well, I'm gonna summarize what's going on here. We have an individual who developed proven Candida auris infection, first in the airway post-transplant, and then in the pleural space. So it was an invasive infection. It was identified early. It was treated effectively, and thank goodness, patient has gone home and seems to be free of this. And now just dealing with kind of more traditional post-transplant types of issues. I think the lessons here for those who are looking at this from, how can I, what lessons can I take from this? I think one of the main lessons here is that the microbiology laboratory went to the trouble to identify this Candida as a Candida auris, rather than just write it off as a contaminant. That was really important, because more often than not, when we get Candida from an airway, we just discard it and we kind of consider it no count. In this situation, it was critical because that Candida made it from the airway into the pleural space. And again, I think there's little doubt that this was donor derived, that is, from the donor. The fact that it doesn't show up in other organs really doesn't mean a lot. Patient could have been colonized in his airway, very likely was. And I think that's the genesis of this infection. The good news is that this seems to have ended well. And as we talked earlier today, that's not the case for so many other Candida auris patients, but it's worked out well for you. And we're just extraordinarily grateful, thankful that it's worked out that way. So I want to thank you both for being on. I'd like to really especially thank you for sharing your story. I think this will mean a lot to those who listen to this episode, and just give you opportunity, if you'd like to make any final comments, and then we'll close.
Well, I just, in closing, I'd say that it was a great job by the hospital, everybody involved at UAB, to go the extra mile and identify it so early. I think that probably was a lot of the reason for the good outcome. It was identified and treated so quickly.
I agree. And one other thing, his was an emergent case that we had we were not planning to have a lung transplant. And because of that, after having the transplant surgery, he stayed in the hospital for 5 or 6 more weeks after that, recovering, because he was so sick. So because of that, I feel like it gave them time after time, because they were doing a bronch, every 2 or 3 days. You guys were coming by to check on him. So it gave us a lot of time to be monitored and stay on those, the antifungal and the antibiotics for a longer period of time than had we just been a planned surgery that was only there 2 weeks and then sent home.
Yeah. All right. Good points, all of you. Can't thank you enough, guys. Love seeing you, and wish you continued improving health. Happy Thanksgiving and happy holidays. And we'll see you in clinic soon, but not too soon.
You.
Okay.
Thank you,
guys.